Hello guys, welcome back to yet another episode of my online teaching class. For today we are going to be learning how to use a glucometer. This video was actually inspired by a lot of mommies and daddies I met back in the hospital during my internship days who complained about not knowing how to use a glucometer. So if you come across this video and you are able to use it, please do well to get it across to people. It will be very important too. And the next thing is that the brand of glucometer I will be using to make this video is not in any way me advertising it. That is because it is against the ethics of my profession as a nurse to advertise a product. And also, if you learn how to use a glucometer with this brand of glucometer, you can be able to attempt, if not able to use any brand of glucometer you come across with. So just to make this video simpler, I sectioned it into the theory and the practical. So this is the theory. I will be teaching us or be showing us the constituents of the glucometer. As you're looking at me or as you're seeing, this is a pouch. Every brand comes in with a pouch. So aside the glucometer machine, the other of its constituents. So to start with, just like I said, almost all brands of glucometer have similar qualities. So what you're going to be seeing in this brand of glucometer, if you get another one, you will be seeing, in as much as it might come with a little alteration, it might come in a little way that differs it from this, but it is for the same function. So let's start with seeing what this pouch contains. First is the glucometer machine itself. Now this glucometer machine, as you're seeing, has two buttons here. At the back it has the battery port, PORT, and then it has the port for the strip, for the insertion of the strip. So what these two buttons we are seeing here does is, actually when you insert the battery, the machine automatically comes up to tell you that it is ready to be used. So this button now sets it or gets it ready to be used. Then this next button you're seeing, what it actually does is that it brings out the readings, the previous readings that this glucometer has done. That's if you have used your glucometer machine to check for yourself or for another person, and maybe you forgot the reading. This button, when it comes up, you press it, it's going to bring out for at least the last two that you checked. And this strip, when I will talk about the strip or during the practical, we will learn more about it. This is the place where you insert the strip. Because this brand of glucometer, just like I've been saying, is different. There are some that this strip, this port, the port PORT for this strip comes at the bottom. There are some that it comes at the side, so it can come here, it can come here, it can come at the bottom. This one is actually located at the top. If you don't want to call it the strip port, you can call it the entry, the entrance for the strip, anything that works for you. So that is it. Then the next thing we're going to be looking at is the vial or the airtight container. This actually contains the strips. And just like we said, the strips are the ones that are going to be inserted into the glucometer machine. The strips, this is an airtight container, and it is so because air is not meant to gain access into it. A lot of people have complained that their glucometer machine has gone bad because when they use it, it drives error. That is actually because they have allowed air gain access into this container. So what you should do is that whenever you're ready to use this, you open, bring it out, and close back immediately to prevent entrance of air. Then the next thing we're going to be looking at is the lancet. Now what this machine actually does with the lancet needle is that when you insert this into the lancet and pierce the skin for blood to come out, remember a little quantity of blood, it is usually painless. So the function of this is to pierce the skin for blood that will be used on the strip and then while it is inserted into the machine. So the next thing we have here is the battery. For this brand of glucometer, it actually came with one battery. Some can have two. I don't think I've seen three. So that is just it. So this is the end of the theory section. So before I start the practical aspect of this video, I want to say that checking your blood glucose level is very important. It is important for our parents, it's important for us youths, it's important for the pregnant women, it is important for everybody. This is because I think I've actually done a video on diabetes mellitus. We know the disadvantages of sugar, of glucose, blood glucose in the body. So you need to every time, at least every month, know your glucose level, so that when anything happens, you can look the doctor in the eye and say, yes, I checked my sugar level last time and it was this. Please do well to get this in every family. And that brings me to the normal value of blood glucose level. That is 70 to 120. Now anything below 70 is low, and anything above 120 is high. And in the checking of blood glucose level, you have fasting blood sugar and you have random blood sugar. In fasting blood sugar, you're talking about when this person that is checking it has not eaten. And fasting blood sugar is usually meant to be a bit lower, because at that point in time the glucose in the blood is not much, because the person has not actually eaten. Then the random is any time of the day when the person has eaten. So it doesn't really, to get the fasting blood sugar in the hospital, we usually do it in the morning when the patient wakes up, because some might tell you they've not eaten while they've had 1 or 2 in their mouth. So that is the accurate time to actually get it, or when the person has fasted, the person has not eaten anything. So to start with, remember I said for this glucometer rather, it came with just one port. I want to take my time to make this video so that anyone who is learning this for the first time will actually appreciate it and know it. So I don't want to be fast. Remember I said when you put this battery, the machine automatically picks. So just like I said, this bottle is for this. So the last time I checked, it was 129. That is a bit. The last was 89. So you're seeing it as you're pressing, it's coming up. So that is it. Then here we talk about the strip. Remember, I've taken it out and I've closed it immediately. So this is the part of the strip that should go into the pot when we are ready. So this is the point, this is the part where blood, a little drop of blood should enter. So let me show it again. This is the part that goes in. This is the part that blood should enter. When we are ready, we are going to come back to this. So that is it. And the next thing I will be teaching is the lancet. Even though a lot of you don't know, like, okay, I already have a lancet needle in here. So just like you're seeing it now, I don't know, look at this. This is meant to be at the side. So let me take it out. Let me just take it out so I don't have, you see how I did that? You have to be very careful so that you don't, it's fitted. So before I close it now, I have to take out the, you have to be very careful so that you don't injure yourself. Then you clock, and this is clockwise or anti-clock. Okay, this is clockwise. So once you've done this, you set depending on the depth of the skin, then look at me, you draw. Having drawn this, is ready to pierce. Is ready. I don't know if you heard the sound. Let me do it again. So if I actually place this on my skin and click on this, then that means it comes up. And but for some reasons I do not like to use this, so I'm amongst part of the Nigerians that do not like stress. I just use the lancet needle directly. But the next thing, another thing I want to say is that this lancet needle is non-reusable. Please use once and discard. So because this is not hospital, I am not able, I didn't see cotton wool, the normal cotton wool. I'll be using our, so having gotten this, I already touched my sanitizer already. Remember I said I will be practicalizing it so that you can learn it perfectly. So I love to use my tongue. Remember, this is an invasive procedure, so please do well to protect yourself. If you are doing it for somebody, blood is going to be coming out, you never can tell. So please wear your gloves. Because I'm doing for myself, that is not why I'm not wearing my gloves. So I've cleaned my tongue. I just said it that I love to use this straight. This comes with a lot of this. So I am part of the person that love to insert the strip before puncturing, because for some reasons I feel it's not advisable that after puncturing and blood is trickling down a person's finger, you now start bringing out the lancet and fixing it and everything. Some people have bleeding disorder, or for some reason it doesn't just sit well with me. So I love to insert. It's better I waste a strip than to waste somebody's blood. So how do you insert? This is a very important part, because if you don't insert well, this is going to say error. insert till you meet a resistance. So let's go together. Remember, I said it is this part of the strip. Even if you're using another one, it looks like this. It looks like an arrow. So we are inserting. So to the point, it even makes a noise. So having cleaned my thumb to the point where, okay, just a little drop of blood. As you can see, my hand is shaking. Okay, now it is reading. So while this is reading, I guess my cotton bud and I stop the bleeding. Then this is it, 103. That is how to check your blood sugar level or your blood glucose level. The simple way, the simplest way. So in the comment section, if there is any part of what I did here that you don't understand, please do well to comment. Thank you very much for watching. I remain your girl Nostalgia. Hope you enjoyed the video. Bye.